Hello, this is Vaughn Clement. This is A1 Health Records. This application is for tracking health histories on individuals in your family, or it could be somebody you're taking care of, to track both health insurance, doctor's appointments, medication, and other related information to visits to the doctor. This is the main screen when you access the application. You're going to see a list of the current records that are already in the application. So as you create health histories, you could change records by clicking on the icon in the row to change to a different record. In each case, for example, you add the name of the person and the date you started the record. It'll automatically add the ID. And then you can do a short description of the health problems that this person is having, whether it's an illness or an injury. Let's go in and start by looking at the doctor's health appointment and health information. In this screen, basically, you see some information that was brought over from the main screen. You can track appointments. This is a portal that has an endless number of different records that you can add to it. So for each appointment that you have, you would pick these fields and fill them in for the type of appointment that it's going to be, the doctor and the information about times and dates and telephone numbers. And you do that for each appointment. Obviously, you have things that you can track, like your copay and your sum for your prescriptions, retail prescriptions, and sum for retail cost for the prescriptions. There's additional information about the illness that came over that you can add data to as far as more explanation. When you go to the doctor's office, a lot of times what happens, you reach the doctor's office. If you bring the iPad with you, as the doctor's speaking to you about the symptoms, you can have them already documented. You can have things like your blood pressure already put down. So if you take your blood pressure, you can have the findings for that. If you have a doctor that gives you a diagnosis, you can put the diagnosis in the fields, or recommendations the doctor gives you, and you keep track of those for each appointment. And then you can list the prescriptions that the doctor gives you, so you have a reminder about exactly what was given to you and what date and time, as far as the type of amount of pills that you're going to be taking, the quantity, and so forth. The next thing you're going to want to do, if you have this information all entered, is to check with your primary and secondary insurance companies, and then track primary and secondary billings. If you go back on the main screen, you'll see that you can start by looking at the primary billing. As you make payments to the primary accounting, it'll show the amounts that are due, the date that you paid, the amount you paid, the balance that are due, and the summary for those that you're paying as far as your health maintenance costs, and how they're paid, monthly, every 6 months, or annually. Then this is the information for your primary carrier, so you have that information in there. And then you do the same thing for your secondary carrier. This is if you're paying another fee for the secondary carrier and the information, and then the people that are covered for your secondary carrier, and any coverage information that you have, and of course, again, the information for your secondary carrier, and whoever it was when you started the coverage. Then the actual billing, you can track the billing and make sure that you are up on date and have paid everything, and you have a running record of all the payments that are being made. The primary billing due is here, and what you paid as far as your actual charges from the insurance company. And then if you have secondary charges, you have a secondary if you paid for particular things like a claim cost or a payment that was related to your portion of the secondary insurance. And all that will be shown and totaled, and information for billing comments can be added at this area. You also can get support for this application by clicking on the support icon at the top of the screen. What I suggest you do with this application is to read the user guide to get the detailed information about how to add information, where to start, and how to maintain the application and information within it. It's a very detailed user guide, so please take advantage of that particular user guide. Thank you. Thank you for taking the tour.